Our question today says, the nurse has taught a client with end-stage kidney disease about recommended dietary modifications. Which of the following menu selections by the client would demonstrate a correct understanding of the teaching? So here we are looking for a food or menu selection, right, that would be okay for clients with end-stage kidney disease to eat. So option 1 says oranges and strawberries. This is going to be an incorrect option. So oranges are really high in potassium, so we definitely want to avoid that when we're talking about end-stage kidney disease. The strawberries are actually okay. They're not really the problem in this option. Strawberries do have like lower potassium, lower like phosphorus as well, so those would be okay, but we can't pair it with the orange. Option 2 says a spinach salad. This is going to be an incorrect option. Spinach is really high in potassium. We want to avoid it. Option 3 says a grilled chicken sandwich. This is a good source of protein. It's our correct option. Doesn't really have any potassium. So that would be a good choice for these clients. And then option 4 says tomato soup. So we would want to avoid this for a few reasons. So tomatoes are high in potassium. Tomato soup is a fluid, and usually soups are really high in sodium. And those are all things we want to avoid for our clients with end-stage kidney disease. The nurse is caring for a client who had a transurethral resection of the prostate, or a TURP, 8 hours ago and is receiving continuous bladder irrigation. The urine in the drainage bag is dark red and viscous. Which of the following actions would be a priority for the nurse to take? So we are looking for an action that the nurse should do first, something that is highest priority, right? So option 1 says to document the findings. This is an incorrect option. It's not the priority here. We do want to make sure we are adequately documenting intake and output for a client who's receiving bladder irrigation, but it is not the priority action in this case. Option 2 says to increase the irrigation flow rate. This is going to be our correct option. So the goal with continuous bladder irrigation is to prevent a urinary obstruction. Okay, so we have that catheter in place. We're putting fluid in constantly and pulling it out to prevent clot formation and then bladder obstruction. Okay, so we want our urine to be a light pink color. That indicates that like clots aren't forming, everything's flowing well. Light pink is the goal. So when we have dark red, we are not putting in enough fluid. We might have clots developing. So we want to increase the irrigation flow rate, put more fluid in to help kind of, irrigate and wash away any clots that could be forming. Option 3 says to remove the indwelling urinary catheter. This is an incorrect option. It's something we don't want to do. It's not even a priority, right? It's just not something we want to do here. We need that catheter in place, like we said, to be able to irrigate to prevent that the clot formation, okay? And then option 4 says to use sterile water to manually irrigate the indwelling urinary catheter. This is not a correct option for this item and for this circumstance. Okay, so when we have, the dark red blood, we definitely want to increase our flow rate. If we have no output, we are seeing nothing in the urinary drainage bag, we likely have developed a clot and we have that obstruction, so we can't get any flow out of the bladder. So with this, we want to manually irrigate the catheter to help dislodge any clots. So I know that's kind of a lot to think about, but we just remember here that like light pink is the goal and we are trying to prevent bladder obstruction. The nurse is performing peritoneal dialysis for a client with chronic kidney disease. Which of the following actions should the nurse take? So we are looking for something the nurse should do when performing peritoneal dialysis. And with peritoneal dialysis, we instill dialysate into the peritoneal cavity, let it dwell for a prescribed period of time, and then we drain it. Okay, so keep that in mind. Option 1 says to chill the dialysate prior to administration. This is an incorrect option. We want to warm the dialysate actually before we administer it. It helps with client comfort, first of all, right? We don't want to instill a bunch of cold fluid into somebody's peritoneal cavity. And then also when the fluid is warm, it helps kind of dilate those vessels, can help increase urea clearance. So we definitely want warm when we're talking about peritoneal dialysis, okay? Option 2 says to perform the exchanges using clean technique. This is an incorrect option. When we are doing anything with peritoneal dialysis, it really needs to be sterile technique. We are putting fluid into the peritoneum, not somewhere that fluid normally goes. We don't want to introduce any kind of bacteria there. We want to make sure we keep it very sterile. Option 3 says to maintain the client on bed rest during the dwell period. This is an incorrect option. Clients don't necessarily need to be on bed rest during the dwell period. We can cap off the system so they can perform like normal kind of ADLs and those kind of things. I wouldn't do anything like strenuous, but they can, get up, walk around the house, go get a drink, like those kind of things are totally fine for these clients to do. Option 4 says to check the client's serum potassium level prior to instilling the dialysate. And this is going to be a correct option. We know that with dialysis, we can have electrolyte imbalances. One of those is a potassium imbalance. So when we are pulling extra fluid, we can also lose that potassium, which could give us hypokalemia. We could see EKG changes with that and whatnot. So we want to make sure that we are definitely monitoring our clients' electrolyte levels throughout their dialysis treatment. The nurse is assessing a client who has a urinary tract infection or a UTI and is receiving phenazopyridine hydrochloride. The nurse would expect the client's urine to be what? So let's jump right into our options. Our option says bright yellow. So this is an incorrect option. Bright yellow urine usually is a sign that our urine is very concentrated. It can happen when we're dehydrated, but not expected with this medication. Option 2 says light orange, and this is going to be our correct option here. So phenazopyridine does cause us to have that it's like an unusually orange urine color. It goes away when you stop taking it. It has a dye that causes the urine to be orange. So it's not a cause for concern. It's kind of an expected thing, but we definitely want to tell our clients to expect that because it can be a little frightening the first time you see it. Option 3 says dark brown. This is going to be an incorrect option. We would expect dark brown urine with maybe rhabdo when we have that like tea-colored urine, or with nitrofurantoin, which is used to treat a UTI. But we don't expect that with this medication. And then option 4 says pale red. And pale red urine usually is indicative of bleeding somewhere in the GU tract. So not a side effect of this medication at all. So just, make sure to educate your clients on that so they don't freak themselves out the first time they go to the bathroom after taking this medication. The nurse is assessing a client who had an arteriovenous fistula created in the right forearm 3 days ago. Which of the following findings would require immediate follow-up? So notice that word immediate is in bold. So we are looking for a finding that is the most dangerous, indicates the worst complication, something that is potentially life-threatening, things like that. And then with our fistula, our arteriovenous fistula or AV fistula is a preferred method of access for clients who are receiving hemodialysis. It's really the best. Once we create it, it takes a while to mature, a few months before we can start using it. But it is a really, really safe and great option for clients that require long-term hemodialysis. So option 1 says pain at the fistula site rated as 4 on a scale of 0 to 10. This is going to be an incorrect option. While we do want to follow up on that pain, is it normal since they just had this placed 3 days ago? Is it indicative of something that's wrong? We're not really sure, but it's not the highest priority once we read through the rest of the options here, okay? Option 2 says a whooshing sound auscultated over the fistula. This doesn't require follow-up. This is actually a good sign. That indicates a bruit. Is that kind of like whooshing sound when you put your stethoscope over the fistula. And you should also be able to feel a palpable thrill on a fistula as well. That indicates that we have blood flowing through the vein like it should be. So with a fistula, they take basically an artery and a vein, hook them up for lack of a better word, and so you have arterial blood flow through a vein. And because arterial blood flow moves with more force than venous blood typically does, you'll be able to feel it and hear it with that bruit and thrill, okay? Option 3 says a +1 radial pulse in the right arm. This does require immediate follow-up. This is our correct option here. A +1 pulse indicates a diminished pulse. We can barely feel it. Because we've been in there, we've been messing around with our arteries and veins, right? We could have impaired perfusion and then limb ischemia eventually, and possibly lose that arm if we don't intervene. So this is something we would immediately want to report to the healthcare provider. And then option 4 says 2+ edema on the right arm. So this might require follow-up, right? We don't know how edematous this arm has been since they placed the fistula. We may require follow-up or at least intervene, right? Elevate that on a pillow, those kind of things, but definitely not as big of a deal as potential loss of limb. So option 3 is our correct option here.